Hi, and welcome to episode 91 of the Pet Behavior Chat. And we've got a little bit of a controversial, maybe, I don't know if controversial is the right word. I mean, for me, exciting, but a little bit of, I guess, a new concept. And I think everything that's new probably has question marks around it. A new concept in veterinary medicine, and that is something called open concept. And I have Nora here with me today because the two of us have been really kind of brainstorming this idea for my clinic in Abu Dhabi. And I think it is inadvertently something that I have been doing for longer than it's been kind of an official concept in my mind, with especially a lot of my behavior patients that ended up having to come into the clinic for a procedure, whether that was for perhaps a neuter or for a pain study or even just for vaccinations. The thought of how I could manage things in a way that was going to be least stressful for the patients. And a lot of that time, that means including the owners, the caregivers in that whole process. And so with that thought came this idea of just having the clients be there for the majority of the procedure. So I can think back to an earlier experience or an earlier client where the dog did come in for a neuter, and essentially the owners were with the dog from start to finish, almost, aside from the actual surgery itself. But as soon as the surgery was over and we were waking the dog up again from anesthesia, they were there. And it ended up being this incredible experience for everybody because the dog opened their eyes and there were his parents. And the whole thing was so much stress-free, or so much more stress-free and so much more comfortable for everybody. And the clients loved being a part of it, that I started to think about, gosh, shouldn't we be doing this really for the majority of our patients where we can? And I'm going to tell you a personal experience from myself on that in a second as well. But first of all, before we kind of go down that rabbit hole, welcome, Nora. So lovely to have you with me again and to chat through this, because I know it's something that we've been talking about a lot, and you've been kind of putting feelers out to the rest of the team in the clinic to see how they feel about things. And so we just want to have a really open conversation today about the potential benefits, but also some of the challenges I think that come with thinking about something like this, a new concept, but also the benefits that it can have for both the clients, the owners, the caregivers, especially the patients, but also eventually for the rest of the team. So welcome. Lovely to have you here.
Thank you. I think this is a very exciting topic right now.
Yeah, it is. So what were your first thoughts when I kind of said to you, hey, I want to explore this. I want to see if we can make this a thing. Like, what did you initially think?
So it was around the same time I had actually heard about a clinic in Texas in America doing it kind of from a different angle, but I found it very intriguing. And I think we naturally here are kind of always looking for the next bigger and better way. And when you explained, what open concept sort of meant to you, a large part of me was like, well, we're halfway down that road already. That's, it's a name for this thing that we're doing where we're including owners. And it sort of all clicked. And yeah, I think I got it immediately. It just felt like the natural next step for us to take here. And it was good to be able to have a name to something that was at the time sort of, done sometimes, I guess by those brave enough to do it. So you would do it. Sometimes people would, follow your suit and try it as well. But then maybe lots of members of the team didn't know if they could, open the doors like that and have the authority to practice open concept care, I guess. So it was good to be able to actually start working towards making everything open about open concept.
Yeah. And what would you say open concept means to you? Like, what do you think are some of the cornerstones or the key aspects of this whole idea of working in a more open concept way?
So for me, it's about allowing the owners or inviting the owners to be very much part of the treatment team. So instead of the traditional, an owner brings the pet to the clinic who maybe is sick, and then the pet is essentially handed over. The owner has to completely trust the veterinary professionals, and the animal is taken away to a staff-only zone and cared for there. Now, obviously, all the care is very high quality, and everybody wants the best outcome, but from the owner's perspective, they don't really know what happens next. They don't get to see it. And for the pet's perspective, they're taken away from their owner and from their home. So it's an idea of stopping that and opening it up in the middle and actually inviting the owner in. So for example, if we're admitting a dog for hospitalization, then the owner is actually coming up to the preparation area and is holding their dog while initial blood samples are taken, and is holding their dog while an IV catheter is placed, and is able to lay in the large kennel with them, having their lunch and trying to tempt their dog to eat at the same time, and is able to spend 8-10 hours a day here as part of the team to actually be that element of comfort for their animals. So it's, the ability, and not all owners will be able to do all of that all the time, but the doors are open for them to if they want to. And it's something that we actively encourage. So that, for me, the owner involvement is a huge part. I think the idea of transparency of vets and nurses very openly, very frankly, explaining everything to owners. And we're lucky here in that we do have longer consult times than most clinics, but to actually really get into the nitty gritty and explain all the different options, and again invite the owners to be part of that treatment plan. So it avoids any gray areas and later owners not understanding what the treatment process was. In fact, it makes it easier, I would say, for vets to be able to have that open discussion at the start and throughout, rather than feel that there's any issues later, them having to explain what they did and why. It was an open conversation throughout. And I think that, within the team too, that open concept, it's funny, it reminds me a little bit of us becoming fear-free and addressing, fear-free elements, not just with pets, but with team members too. That openness has kind of naturally or organically happened here too. And that being open and honest earlier on with our clients has helped within the team too. And, being able to have open conversations. It's all those things. It's about openness, transparency. But I would say the biggest part is owner involvement in the treatment plan of animals.
Yeah. And I can already hear a lot of listeners raising their red flags and alarm bells going off everywhere. And we're going to deep dive into that. So I think when you said the words of, owners actually being present when, blood samples are taken and IV catheters are placed, and maybe, being involved in holding their animals or reassuring them in that moment. I think there are many, many, many who would be now concerned about the safety aspects to the team around that and all those sorts of things, which I completely understand. But I think when you've been practicing in a fear-free way for quite a long time, it's almost like, I don't know, it's not that that's negated. That's not what I mean. But we try not to have our patients in a state where they're going to respond negatively or aggressively anyway to being restrained or held. So I guess for us, when you say that, I naturally think, oh yeah, that makes perfect sense. But I also know, because I've been in the industry long enough and I've worked in all the practices all around the world, that would be a big red flag and a big concern for quite a few people. So I think we'll come back to that, because I think addressing the concerns of the team, the safety of the team, and there's a bit more to kind of dive into there, because I think there are other aspects that go into that as well. But so all the things you said, I completely agree with. But for me, there's one other thing that's really important about this idea of open concept, and that is the idea of emotional safety. And it's something that isn't being spoken about a lot yet. I actually did a presentation on emotional safety at the Veterinary Management Group conference in the UK back in April. And emotional safety is different than psychological safety, right? So psychological safety is the ability, if you're part of a team and working somewhere, the safety to speak up, to make suggestions, to call things out and be heard and be psychologically safe in that situation. Emotional safety comes a lot more from the patient's perspective. And the reason I actually went sort of down this rabbit hole, as I said earlier, was because I had an experience when I was 4 where that whole emotional safety piece for me when I was just a little girl was really not there. So when I was 4, I had a teeny tiny routine surgical procedure, umbilical hernia repair, but this was back in the late 1970s. And I was taken to hospital. I actually was hospitalized for 3 nights, which seems like a long time now for a little umbilical hernia repair, but that's how it was back then. But I was separated from my parents, and my parents were only allowed to stay with me during very short visiting hours throughout the day. So they would be able to come for like an hour in the morning and then maybe 2 hours again in the afternoon. The rest of the time, I was separated from my mum and my dad. I was in this unfamiliar environment. And I can also remember this kind of non-consensual handling, I would call it now. Obviously, when you're 4, you don't realize that, but having things done to you that you don't understand why, you know, whether it's having your temperature taken or receiving medications or, you know, having other things done to you that just, you don't have anybody there with you. My parents weren't there. So it was just myself, the nursing team, that, you know, the doctors there. And I can remember there was one particular nurse there who was a very sort of an older, very matronly nurse, and she scared the bejesus out of me. And I still now remember the feelings of fear when I think about that time. And it got to the point where I think it was like I was admitted on a Tuesday. I was there until like the Friday, and then they wanted to keep me over the weekend. And at 4 years old, I think I said to my parents, I'm not staying over the weekend. I want to go home. And my parents luckily listened to me, and they actually kind of discharged me against doctor's advice. And then I was told I had to just like stay at home in bed and wasn't allowed to leave bed. But that's how, even as a 4-year-old child, how affected I was by this whole situation. And, you know, as then I became a vet and I kind of got more into thinking about fear-free and doing things differently, that experience kept kind of like coming up in my mind. And then when you think about it, it's exactly what we do to our patients in a traditional veterinary setting. We take them away from their caregivers. That whole, I mean, how many times have, you know, I admitted a dog for a procedure and the owners have left and the dog's been like straining to, you know, and then you have to like, no, come upstairs with me. And sometimes, you know, the owners would come up and help settle them in, but that it's not something that was done. So there's the separation from the caregivers, i.e. separation from the parents, being in an unfamiliar environment, same for our patients, and that non-consensual handling, same for our patients. It's exactly the same thing. And you know, and when I think about, I mean, Nora, you're a mum to 2 young girls. I mean, could you imagine like them being in hospital and you not being able to be with them? Like now in pediatric medicine, that just feels like what? Like who would ever do that? But I feel like in veterinary medicine, we're still stuck in the late 1970s, how we were when I was 4 and went through the whole thing. So that for me is another massive piece of the open concept, is that emotional safety piece, is thinking about, well, how does that patient feel in that moment? And surely they have to feel better if their caregivers are there and they're bonded. And look, granted, maybe not every caregiver is the right caregiver for that, but we have to allow for that possibility in at least the majority of cases that we see.
Yeah, I mean, I had a similar experience just a couple of years ago as a mother, where my baby at the time was unwell, and there was talk about admitting her to the hospital. And when we were there, the nurses were adamant that she was taken away from me to place a catheter, which just in every fiber of my being was wrong. And I refused and ended up discharging us before and going somewhere else because it was just so unnatural. And no, you know, there was absolutely no way. Yeah. And I remember thinking, yeah, that we provide here at the clinic the opportunity for pets and owners to stay together, and that should just be standard. But there is a long way to go. But yeah, I know that feeling from the mother's perspective too, what you spoke about, and for sure it's the very same when we think about pets and the relationships that owners have with them. I mean, we see that every day, how bonded pets and their owners are. So it's those same emotions, yeah, and that safety element is huge for sure.
Yeah, and I think it's just such an accepted thing that we take them out the back, right? It's such an accepted thing that, and especially if they're like, if the pets are showing signs that they're not comfortable, they're not happy, if they are, resisting being handled and being a bit wriggly, then it's traditionally what we've always done is we're just going to take them out the back and get it done. And we know that taking them out the back may shut down behavior. That's why they're then still and good in inverted commas, because we've taken them away from their safety blanket, and their fear and anxiety now takes on a different cloak, if you like. They're now no longer able to behave and communicate that they're not being happy. Now they just shut down and tolerate, but that doesn't mean that they feel better. They probably actually feel worse in that shutdown sort of way. So yeah, and it was funny actually, when I gave this presentation in the UK a couple of months ago, these were exactly the questions that I received from the audience afterwards. It's like, well, what about those patients that are just better when they're taken away from their caregivers? And I think we have to start changing the way that we think about some of those things. And I'm 100% certain that what we're talking about right now is going to probably spark a little bit of resistance, I think, in many people listening to this, because I get it. Like, this is the way we've done things as a veterinary profession for, certainly the over 25 years that I've been in the profession. But I just wonder whether we could open our minds enough to allow other thoughts in, or other ways of doing things in.
Yeah, I think, the taking them in the back is one very common term in all clinics worldwide. And second to that being, if you just want to wait outside, maybe she'll be better without you, which is the same thing. And I recently saw here in our clinic an owner waiting outside the room, and I said, is everything okay? And she was like, well, my dog's always better when I'm not there. And she had just arrived here from another country. And I was like, oh, how so? And that was just what she had learned from veterinary clinics and from veterinary visits, that her dog did better without her in the room. And at the same time, though, she could hear that she wanted her in there. And I was like, come back in. And we ended up having a great visit, and found an even better solution for her, which was home visits in the future. But yeah, it's just such a common misconception. And I think that it is very scary to try something different if you haven't. I think that definitely over the years trying to get, and that really came with our fear-free approach too, but trying to get all vets and nurses on board with like that first trying time, that first time when things aren't maybe going exactly how they thought it would. They need to do something. They have a task at hand, like let's say getting bloods or giving a medication. And the natural next step from their traditional training would be to remove the animal from the owner, and instead saying, okay, this is what we're going to do. If you want to cuddle them, if you want to hold them, if you want to come upstairs while we do this, and just trying it that once. And I think that really doing that, you see the benefits for yourself. It's just having the courage to try it the first time. Yeah. And I also think what's extremely important, what comes before that, is to make sure that the owner knows what to expect. So that's very important. Like if I'm doing a blood draw with the owners in the room, I always let them know ahead of time, or ask them ahead of time if they're okay with the sight of blood, because things like that can be upsetting. And of course, there's exceptions in those occurrences. But to prep them, this injection is a little bit stingy, so she might not like it for a second, but then this is going to happen and this is going to happen. As the vet or the nurse being able to give them a full explanation of all of the scenarios that could happen, leave you feeling a bit more safe in that situation to then proceed. Because it is also the vet's emotional safety, the nurse's emotional safety. I think so many are, worried it would go wrong, worried they will get in trouble, worried there will be a complaint, or the owner won't feel comfortable or whatever. So I think that the veterinary professional's emotional safety is also really important in that. And that's where open concept kind of comes in, being really open about it ahead of time, talking through things, and having the courage to go for it.
Yeah, no, I totally agree. And this was actually an interesting question that came up from the audience at this conference in April, was what about the team's emotional safety and psychological safety if a caregiver does come in, and if that caregiver responds negatively, if either that caregiver gets very, very upset at seeing their beloved pet in a vulnerable position or in a vulnerable situation, or if the caregiver gets very emotional, or even perhaps a little bit confrontational, or whatever it might be, what impact does that have on the team? And that was actually a great question from the audience, because I was like, that's a great question. I really hadn't thought quite that far yet. And I think that's a little bit also the thing with the open concept and things like that, is that we haven't got all of the answers just yet. And we're going to come up against situations and new situations, because this is such a new way of doing things. And those are all things to consider, because absolutely the team has to be safe, and that has to almost come first in a way, or certainly be as important as everybody else's emotional safety and physical safety, right? So there is that piece as well. If we do have an emergency situation and we have a dog that comes in severely injured, and we're not able to, spend much time on fear-free approaches because it's just an emergency and we have to get on with it. And we know that if there's pain involved, whether that's a dog or a cat or any other species, that they may then respond defensively, aggressively, whatever. So in those moments, is that open concept still appropriate in that moment, or how might that look in those moments? So I think there's a lot that still is left to learn and to understand and to figure out. But I think even just allowing in some of those thoughts, and in the cases where it absolutely is okay. I mean, I've got one little canine patient that's a behavior patient of mine, but that comes in every year to see me for vaccines, sometimes for dental cleaning and for just general, annual check. And that little dog, unfortunately, cannot be handled without being sedated. And we have this set routine set up now where, the caregiver comes in, she knows exactly how to hold the dog, has PVPs beforehand. She knows exactly how to hold him. She holds him while I sedate. We have a kind of a routine that we go through every single year. And it just wouldn't be any other way for this dog anymore. The dog wakes up with her there. She knows to bring enough time and, bring coffee with her and all those things. And it's just now a way that we do things for this particular patient. And I think that's something that's going to just grow and grow, I think, from our perspective.
Yeah, definitely. I think what's really important too is for vets and nurses who are dabbling in this and trying it out, is to record those wins and that, and to record what works. That we make sure that all of our colleagues are aware of what works and what doesn't work when it comes to trying new things like open concept. The same goes obviously for fear-free practices, and that, favorite treats or likes and dislikes as far as, the gender of the staff, those sorts of things. Recording it and being very open with your notes is definitely going to help for the next time, and help create a bit of momentum and a bit of like a learning space for what patterns you're seeing, and what works for individual animals, and what sort of things you can keep trying. So I think recording that information is really important.
Yeah, no, I totally agree. It's all about, like you said earlier as well, that open communication, which can sometimes be tricky, especially if you're under time pressure. And we all know that the veterinary profession is up against it right now. I mean, everywhere, vets are challenged. They have to be task oriented a lot of the time. They have to get the job done, if you like. And sometimes there isn't that time or that space to work in ways that might be different or new, or, figuring things out. There's just oftentimes not space that allows for that. But luckily, we do have that, and we're able to maybe trial some of these things and maybe even model some of these things. So I thought in the last, go ahead.
Right. No, I just wanted to say, I agree. And you're right about time. However, I think our experience has been similar to cat friendly and fear free. Actually, it saves you time in the long run. We definitely see great patient outcomes when it comes to open concept in the care. One example, if you have a patient who needs to be hand fed, an inappetent pet who really is not eating, and the time that that's involved with, potential feeding tube, and that And then when you have the owner there, how much time that can save. And actually often, you know, they start eating a lot faster for their owner. That became one of the first ways we started getting owners in more and more, was if we had inappetent dogs or cats and we couldn't get them to eat, we had tried every single food, we had tried every trick in the book to get them to eat. And then the owner came in and then they ate. And then we started to see that, you know, how beneficial that was. But in very same as some of the other things we've implemented here, it sounds like it will be time consuming, and in some bits it is, but actually overall, I believe it does make things easier and it saves time, and that it gives just a greater satisfaction to how you work. It's so nice to be able to invite owners to do that. Yeah, I think it really pays for itself.
Yeah, no, I totally agree. And I think, as with anything, of course, when you first start something, it's going to be a bit clunky and it's going to maybe take a little bit of time. But I think just, you know, trusting the process and knowing that it's going to be something that in the long run is going to benefit everybody, I think is a really great way of thinking about it. So yeah, I just wanted to actually chat through a couple of cases that we've had, just to give a few examples of how this can work. And I also just want to mention the Veterinary Emergency Group in the US, which is where, Nora, you and I both have taken a lot of inspiration from, just looking at some of their social media content around the way that they do things. I think that's definitely something that has inspired us, you know, seeing the way that they actually have like little rooms and beds for owners to be able to stay the night if their pet has been involved in an emergency and they don't want to leave. And you know, having pictures of the dogs sitting on the sofa with an IV drip attached while their owner's working away on the laptop. I think those are some of the things that inspired us. And certainly for me, one of the things that massively just triggered it so profoundly with me was seeing a number of dogs, when I sort of trialed some of this, seeing a number of dogs waking up from anesthesia, and that moment where they wake up and they see their owners there and their tail starts to wag immediately, and the recovery is smooth and everything is just so much better. There are a couple of sort of key moments for me where I was like, oh my God, like this has to be like the next thing. But yeah, what are some of the cases that are memorable to you? Sorry, you were going to say something again.
No, I was going to say it's one of those most dreaded times in a veterinary practice is dogs waking up from surgery, because it's so often there can be a recovery that's not so smooth, and it really is a stressful time that requires a number of members of the team sometimes to supervise. And we have found absolutely having owners present just makes it so much smoother. It's really, really nice. So that of all the times, I think one of the most important. I mean, on a daily basis, just, you know, getting bloods and everything is great with the owners. We find pre-surgery, doing that with the clients to then be able to run the bloods while the animal stays with the owner just makes it a bit nicer all around. But we recently had a case where this very beautiful little doggy had, unfortunately, her jaw broke on both sides after being attacked by another dog. She did require extensive surgery and a feeding tube, and her owners were able to be here with her for several hours a day, which she found very, very comforting, and led to her going home just a few days later, which was great. I think another one, a beautiful little doggy also who had pancreatitis, who was quite shy of a number of members of the team. Her owners both were able to work remotely for most of that week, and they just sort of became parts of the team and had their laptops here, brought their lunches here. We set up a space for them. And it was so lovely to walk in and see her, again, receiving her medications on her drip, but on her owner's laps. And they were actually still able to be productive. They didn't essentially have to miss time from work. I mean, there are so many. I think that really it's becoming more and more common here, and it's just a lovely thing to be able to offer. There was a doggy as well, very, I think, trying to remember what breed she was, but a very older dog who was probably coming to the end of her life, and her owners were providing her with palliative care. And while she needed to receive treatment, they didn't want to miss any of that time with her. So they were also able to stay here with her throughout the whole day. And it's just, yeah, it's really lovely to be able to see those things. I think end of life is definitely a time when it matters a lot. those days sometimes can be really precious. So to have your pet in the veterinary clinic and you're unable to get to them can be really hard on owners and on pets. So being able to bridge that now has felt really nice.
Yeah. And I think we've also had a couple of cases where I think had it not been for open concept, the pets wouldn't have received perhaps the care that they needed because the owners just felt so uncomfortable leaving their pets anywhere. And I mean, we even had one client travel from Dubai to us to receive, dental treatment because, again, an anxious dog, and they were able to stay with the dog the entire time, which is something that they'd requested and were denied, previously in other clinics. So, and that's another thing, right? Is actually ensuring that the pets get the care they need. I think that's such an important piece as well.
Yeah, definitely. I think there's been a number of cases where owners are so relieved to hear that the answer is yes to that sort of thing. I really hope it becomes something more practices embrace. I think even for, practice owners and managers listening, that you can hear from that. It's also good for business, essentially, because you're saying yes to something others are saying no to. And it's good. It's good all around. I think the biggest challenge with implementing open concept is with getting the team to that point of emotional safety. I think that's definitely the hardest part, but also I think that within any team, that's why there are leaders and people who start the process and who can focus then on that emotional safety of the team members. Because I really think open concept is the way of the future, and that it just feels a little bit scary now because it's new.
Yeah, I agree. And I agree and obviously you also need the team to buy in to be able to make it a successful process, right? You need people to be on board and see the benefits. But like you say, if you're brave enough and, if you have the courage to go first and model some of these new things, then the hope is that others see actually how beneficial it can be. And I think like I've said throughout this whole episode is, I haven't got all the answers. We haven't got all the answers. It's something that we talk about a lot and we'll probably continue to learn for the next 5, 10, forever years, how to make this better and better. And we did the same with Cat Friendly, and we did the same with Fear Free, and we still are doing the same with Cat Friendly and Fear Free because the learning will never end. But this is just, I think, the next step. And it's very, very fulfilling to see some of these outcomes, cases, interactions. There's also a big human factor there, when you're able to make the connections with the clients that you're able to make, which you might not make if they weren't tied into the process in the same way. So yeah, watch this space. We haven't got all the answers, but hey, let's see where we get to. All right. I hope that this episode has given you a little bit of food for thought. I said at the beginning it was going to be a bit of a controversial episode. I think it has the opportunity to be controversial conversation, and I think everybody's viewpoints are extremely valid here. I also totally get it if people don't feel comfortable or just can't. But I think we're just kind of putting it out there as something that you could think about if you feel moved to, and if you feel somehow aligned with the concept. But yeah, I hope you've enjoyed it. I hope you've enjoyed the conversation and the thoughts around it, some of our experiences, what we've seen with our patients and our clients. And I very much look forward to seeing you next week in episode 92. Nora, it's been so lovely to chat with you. As always, thank you for your time and for being here. Bye for now. Bye.